This video is about the safest or S.A.F.E.S.T approach to violent or agitated clients. You may encounter clients who threaten or exhibit violent behavior. So how do we manage this situation? First, be aware of warning signs of impending violence, such as a loud voice. He shouts, making use of threatening statements, such as "don't come near me" or "you're going to get hurt." He clenches his fists and assumes a fighting posture, such as standing with feet slightly apart and his arms in a striking position. His movements are agitated and he may hit or throw inanimate objects. These are signs that violence is about to erupt. So what do? Adopt the safest approach. SAFEST is an acronym that stands for spacing, appearance, focus, exchange, stabilization, and treatment. Spacing. First, maintain distance from the client. Getting too near an agitated client can be misinterpreted as a threat and can cause them to strike. Also, for obvious reasons, if they do attack you, distance can give you a few extra seconds to escape. Second, allow both client and you to have access to the door. It's obvious on your part, you need to have a quick access to an escape route, so position yourself near the door but not where you would be blocking the client's exit. For the client, the access to the door can decrease his perception of being trapped or cornered, thereby, it can decrease his anxiety. Also, if the client decided to escape, having you between them and the door would not prevent their escape unless you plan to block their exit, which may be a foolish action that could lead to injury on your part unless you are significantly heavier and stronger than the client. Third, do not touch the client without his permission. And fourth, avoid prolonged eye contact. Both of these can be misinterpreted as threats because they are intrusions into the client's territorial space. Remember that in many cases of agitation, the client is acting on his perception that his safety is at risk. Therefore, we don't want to reinforce this perception. Instead, we want the client to feel that he is safe, there are less threats, so that the situation is going to de-escalate. Appearance. This refers to what the client is saying from the hospital staff. First, maintain empathetic professional detachment. Communicate that you are present, but you are not rushing the client's cessation of his agitation. Well, in reality, we actually want the client to calm down as soon as possible, but pressuring them to do so would be counterproductive. We cannot calm down a patient. The patient has to be the one to calm down himself. So when the client feels the pressure, anxiety and agitation levels would go higher. Second, use one primary contact person to build rapport. This is similar to a hostage-taking situation wherein there's only one negotiator. Too many persons to deal with will further increase the client's anxiety. Third, have security staff available. Having security available is a show of strength for the hospital staff. The security personnel is available to keep things under control. Ironically, for some clients, this may also decrease their anxiety because they themselves want a reassurance of control over their own behavior. Focus. First, watch the client's hands. Are they still clenched tightly or are they rapidly clenching and unclenching? Both of these are signs that the client's anxiety is increasing. Is he about to strike? You need to get ready to move away or out. Second, watch for potential weapons. If the client has a potential weapon, don't try to get it. Instead, at this point, move further away so that you will be out of reach. Third, watch for escalating agitation. Aside from tightly clenched or rapidly clenching and unclenching fists, signs that agitation is escalating are heavy breathing, pacing, louder, high-pitched, rapid speech, or the person may stop talking but instead may have more physical behaviors such as kicking or punching objects. Exchange. Delay by continuous talking to permit de escalation. Encourage the client to vent his feelings by talking instead of acting out. Second, avoid escalating prompts, such as agitated behavior from staff, such as shouting or body language that communicates anger or frustration, making derogatory remarks about the client, engaging in a power struggle such as saying, I'm the boss here, you're just a patient, arguing, or becoming defensive. Third, do not communicate the urgency to gain control. As I said before, pressuring the client to stop being agitated will just cause him to be more agitated. Instead, use good listening skills, model calmness in your speech, and tell the client that you want to understand what he's saying and that you can better understand if he keeps his voice lower and talk more slowly. Even among clients with psychosis, the issues that trigger agitation may still be rational and solvable. For example, a client who was admitted only a few days ago is afraid that his family has abandoned him, or another client is suffering from the annoying effects of a medication. So, listen to the client and try to find a solution to the issues that he is going to be telling you. Stabilization. First, physical restraint. If the attempts to de-escalate are not successful, the client's agitation continues to escalate and he becomes more aggressive, then physical restraint would be necessary for safety purposes. Take note, physical restraint is applied only when other measures have proven to be ineffective because physical restraint can produce both physiological and psychological side effects. Now, what to do if it is decided that physical restraints are going to be applied? First, be sure that the client has no weapons in his possession before approaching him. If the client has a weapon, then ask him to put it on a table or on the floor rather than fighting with him to take it away. If the client does not comply, then keep something like a pillow, mattress, or blanket wrapped around your arm between you and the weapon. Then you may distract the client momentarily to remove the weapons, such as by throwing water onto his face. How many persons are needed to restrain a client? Ideally, there should be at least 5 persons, including the team leader. Second, sedation. Give prescribed sedative, usually lorazepam. This is going to decrease the client's anxiety and will cause him to be less agitated. Third is chemical restraint. Give prescribed neuroleptics. Treatment. Once the client is more manageable, initiate treatment based on symptoms. Clients who refuse may need to receive treatment involuntarily in order to ensure their safety and also to ensure the safety of others. What's the role of the nurse here? It is to administer medications and to participate in the treatments that are administered to the client, which are within the nurse's legal responsibility. So that is the safest approach. Very important. In all of the aspects or steps of the safest approach, protect yourself first. Your own safety is the priority. It's just like an emergency situation in a plane. When cabin pressurization is lost and oxygen mask trapped in front of you, and you are seated beside the person you love most, and this person is incapable of putting on his mask. Which would you do first? Put on your mask or assist the person to put on his mask? If you answered assisting the other person, then you could be committing a mistake that would be fatal to both of you. Prioritize yourself so that you could in turn help others. So when a client turns violent, protect yourself first so that you could help others. You would not be good to anyone if you are dead or incapacitated.